A common question that we often get during breast lift consultation are from patients who have done their research online and they say, there's so many techniques out there. How do I decide what's best for me and what procedure would be best for what I've got going on? And the short answer to that is it really depends upon how much sag or ptosis you have in your breast. So the ptosis or breast sag is defined by where the nipple and areola are located in relationship to the crease of the breast. So grade 0 is when the nipple and areola are above the crease. Grade 1 is where the nipple and areola are located at the crease itself. Grade 2 is when the nipple and areola are located below the crease, but are actually not at the most dependent portions of the breast. And then grade 3 is when the nipple and areola are below the crease and also at the most dependent portions of the breast. So these different grades often indicate to us what type of surgery is required to get the maximum lift out of the breast. So if you have a grade 0, which again is the nipple above the crease, many times this can be treated with what's called a circumareolar lift, which is where we make a circular incision around the nipple and areola and lift it to the point that we want. If you have grade 1, which is where the nipple and areola are at the crease itself, many of these patients can either be treated with a circumareolar lift or with what's called a circumvertical or a lollipop lift. And again, these patients require lifting the nipple to the anatomical location as well as a little bit of a vertical incision to remove the excess tissue in the lower pole of the breast. Once you get to a grade 2 or grade 3, many times you have not only a very low nipple, but also some excess skin. And in those cases, we usually suggest what's called a Wise pattern or an anchor scar. And that's where you have a scar that goes around the nipple, down the 6 o'clock position, and along the crease of the breast. This is what allows us to get the maximal lift out of the nipple and areola, as well as to remove a maximum amount of tissue in order to make the breast sort of nice and tight as well. My suggestion is always talk to a board-certified plastic surgeon to help define for you your degree of ptosis and what procedure would be best for your anatomic position.